6:30, so I would like to open the budget forum. We are expecting Board of Ed Chair Brad Bernier, who has not arrived yet. But the purpose of this meeting is, before we get really into the budgets and the creation of the budgets, is to get feedback. I would like to say this is my 10th budget, and when I add up the 9 prior budget forums together, we haven't had as many people as tonight. And last year we had 4 budget forums in January, and we had 0 people show up for 4 budget forums. So appreciate people coming out. There's no formal agenda tonight. We're basically here to find out if people have specific questions, specific comments, things that they would like to see in the budget, things that they don't want to see in the budget. And so therefore we have no prepared presentation because we have nothing to present yet. Board of Ed will be in a couple weeks at they have a special meeting other than their regular meeting. I don't know if it's the last Tuesday or the third Tuesday. 23rd.
Tuesday of the month.
So on the 23rd of this month, the superintendent will present the Board of Ed budget, and that'll be at the middle school.
No, I take that back. 26th.
26th. So Tuesday the 26th, and I think they have 2 workshops after that. One is part of the Board of Ed meeting, and one in between. That budget will, after they kind of review that budget, that'll subsequently be presented along with the first selectman's town budget on that first Tuesday in April. So I think, which is but it's the first Tuesday in April will be the presentation of both the town and the Board of Ed budget, April 2nd. So I know they've been working on the Board of Ed budget. I don't think formally that the town budget, they usually, even though I'm sure work's being done with department heads, Maggie is usually monopolized by Board of Ed working on their budget at this point in time. So we're just going to open up with questions. At the table is Art Chalowski, the first selectman, and then Andreas Bispikos and Andrea. Oh, you can see the name tags from Board of Finance. We are expecting 2 more members tonight to be here, and as well as Brad Bernier. And I know we have some members of Board of Ed, as well as the selectmen out in the audience. So who would like to start?
I'll start. Hi, I've been a substitute teacher in Colchester for probably about 25
Take your
years.
name.
Oh, George Brown. And in the last 18 years, we have not even got $1 a day pay raise. We're still making $85 a day. And I want to, find out when you might consider giving us any kind of a raise. And the minimum wage is going up possibly, with the new legislation. We make $12.60 an hour. I mean, I do it because I'm retired and I enjoy the kids. But, really, it's enough is enough.
Yeah, I think the same comments were made last year. I don't know if discussions will be there, but we have a couple members from the Board of Ed here tonight that heard you.
I heard you.
Yeah, can't answer the question, but certainly, a couple Board of Ed members are here tonight to hear that concern.
Okay.
I saw another hand. Okay, other.
My name is Steve Podolsky, I live here in town. I'm going to start the ball rolling here. We're going to talk about this paramedic program that's being proposed. I don't know how many of you folks have ever ridden in an ambulance. I had the occasion to do it twice with these people. And sitting in an ambulance where, you're not in the best of condition, basically your life's on the line, and you're waiting for a paramedic. They do a good job, but they can't be there in a rapid time, and you basically have that golden hour, maybe. I would fully recommend that you have a paramedic. I'm one of the guys who had to sit in the back of there and wait 45 minutes to an hour to decide where I was going to go, how I was going to be treated. I won't go into any more details about that because they're a little gruesome. But I fully support the idea of a full-time paramedic. Yes, it costs money. Put a dollar value on every one of your lives, or your loved ones' lives. If you do that, you're being very much mistaken. Thank you very much.
Thank you. Thank you.
Evening, folks. Steve Schuster from Colchester. I'll address this strictly to the Board of Finance. I think this is a good year for the members on the Board of Finance to look over these budgets that are going to be presented to you whenever and really look and see the difference between wants and needs. And pay very particular attention to the needs as opposed to the wants. Thank you.
Other comments, questions? Vince?
Hi, Vince Rose here in town as well. I just started to jot down some notes as to things that I think would be very helpful to think about as you consider to start putting this budget together, which I don't envy anyone involved in the process. I've seen it. It's a massive amount of work, and I understand there are trade-offs, but I think there are very important considerations. I think that it's important to understand with respect to I'm going to speak mostly to the education budget. The failure to invest is not free. That there are true consequences, and we've seen them already with respect to class size, we've seen them with respect to programs cut. My son did not have a high math option this year. The gifted and talented program seems to have disappeared from at least one of the schools, or is reduced, and I apologize if I'm misstating a little bit, but certainly the Klein program is not available when it was. So these are true costs to what is available to our kids. And we need to, when you're looking, you want to make sure you're thinking about both sides of the equation. With respect to class size in particular, and I would refer the study that I referred you to a couple of years ago, I'll find it again for you. There is well-documented data to prove that class size, if a kid gets behind, it's not a one-time cost. You're going to have to spend more money every year that kid is in the system for each kid affected to try and catch that kid back up. So this short-term gain for long-term cost really has to be put into perspective. Third point, things rarely get cheaper. As you look to kick the can down the road, because you only have a certain number of bucks, think about whether it's going to be maybe just a little bit more money, or is it really a lot of money that we're putting down the road. If it's a big hit down the road, that's not necessarily a true savings. More generally on the education budget, I feel like the increase or lack of increase over the last 5 years has really been put out as a keep the lights on type mentality in the budget with respect to versus stretch goals. And anybody involved in new setting of goals in the last 10 years, stretch goals have been really something that people talk about. What if we had money to invest? What would we want to do with these schools? What are the very best top 5 schools in the state doing? What languages are available over at Glastonbury? Why are we setting our horizon at 0 status quo as opposed to looking what's available out there and then starting to make decisions? I think we need to aim high as a starting point. I would strongly recommend that we do that. I'm just about done here, so bear with me. We were able to pass the school budget the first time through this last year. I'm trying to remember, I think we may have also passed it the first time through the last couple of years. That's another reason maybe we can aim a little bit higher than we have in the past, and I know that there are folks who are committed to getting folks out there to support. Lastly, I think that it's impossible to have a thriving community without a world-class school system. And so I urge you to think strong and invest and support our school system, our kids and our teachers. Thank you.
Other comments, questions? Deanna first and then... Okay.
Go ahead. Well, I just want to touch on the point about class sizes, because that's been talked about in the last few years in the town budget. And we look at our class sizes, we've been really good at getting those class sizes down. So much so, from what I'm hearing from parents, the Board of Ed pulled some paras out of the kindergarten rooms to then move that money somewhere else. So while I understand what he's talking about with class sizes, if class sizes is the problem and addressing the needs of the kids is what you're talking about, then you need to question the Board of Ed why they pulled the paras out of the classroom and diverted the money elsewhere. Second of all, I have the, the actual enrollment numbers for the school. And we've lost another 100 kids or 80-something kids between last year and this year. And you're talking about class sizes at the high school, I would imagine, was one of them, because our highest class size in the middle school is now 23. It was up to 23, it was actually up to 29, I believe, a few years back. So as we've lost enrollment, those numbers have actually gone down. And if the problem is at the high school, we have now taken in, I believe, it's 45 kids now from Norwich. And we've always been told that those kids coming in was a net gain for the revenue, but it wouldn't affect the class sizes. So if I'm starting to hear that those numbers are affecting the class sizes, then maybe we need to go back and talk to the Board of Ed about bringing in additional kids. We started other programs in the town. The school resilience program, which I know it's, I believe, only at 5, but we're looking to expand that program and bring kids in from other areas to do that. So if class size is really going to be coming back as an issue, then I think that we need to look at where we're diverting the money and taking money out of certain areas if this problem with class size is another issue. And I'll just make a reminder, we have almost 650 seats. When my kid went to Jack Jacker, there was 1,000 kids in that school. 1,000 kids in the old school. It's down to 533. The school was built, I believe, for $850 at Jack Jacker. I think there's about 500 kids over at CES. About 97 of those are preschool. So there's a lot of room in our schools. And we made the investment to build a new school. And one of the trade-offs was that, of that was that those monies were diverted to other things to build a new school. So we may now lack that money to invest in the programs going forward. I see you wrinkling your eyes, but those are the facts. Our school system has lost almost 1,000 kids in the last 10 years. And a lot of people in town, as we talk about the growing needs of the town, and as Steve Schuster pointed out, the wants versus need, the population in this town that's growing is the older folks. So the paramedic program, I'm 100% behind. That's something that this town needs as our population starts to age. We have a $40-something million budget. We're now down to 2,317 students. That's $10 million more when we had 3,300 students. And I understand cost goes up, but there needs to be some balance in this town. And I think that the older folks and the paramedic programs are very vital to what we need in this town.
Audrey Babineau. I strongly encourage that you invest in the paramedic program. I've been a member of the fire department for 18 years now, an EMT for just about as many, and on numerous occasions have been in the back of the ambulance with a critical patient and looking for a paramedic who was unavailable for whatever reason because they're coming out of town, they're tied up on another incident in another town. So with our aging population, as she said, and we're just building more senior living facilities, and it's only going to become more critical that we invest in our community in that manner.
Just a question, because I am not familiar with what the proposal is for the paramedic program. Could somebody explain that to me, by chance? What the proposal is?
Chief, you want to explain
Walter Cox, Fire Chief. We've been providing ambulance transport for the last 25 years at the basic level service, which is EMT level. And the paramedic service that we do get is available through Middlesex Hospital. They're the closest medic available. They're out of Marlboro, but they serve multiple towns, and they're only available when they're available. If they're in another town, we call for them. We have a backup system where a medic from Norwich, American Ambulance, comes in, or Middlesex Hospital will bring up another medic if available from Middletown or the Shoreline. The data that we have seen is 5 to 6 minutes before a medic will get on scene after we arrive. What we're trying to do is increase our staffing to have paramedic firefighters. That's a two skill set. They're paramedics and they're also firefighters to ride our ambulances, so they arrive on the scene and you have a paramedic when it's critical that you have one. We can only provide a certain level of emergency medical service that we're trained to do, but when it's critical and you need an IV or you need a monitor that a paramedic carries that reads heart rhythms and stuff of that nature, or a stroke or a diabetic emergency, only a paramedic can provide that. They're like an ER on the scene. They're the eyes and ears of a doctor. So we feel after many years of seeing this that there's a gap in service, and we would like to provide it. There is a startup cost. There is an increase into our budget, but I think over time we'll be able to recoup most of that. But the primary reason we want that is to provide the service that we feel. One is the changing demographics. We do have a lot of elderly and senior citizens in town, and but it's not only the elderly, it's the young or something that's critical. Too many times we've seen where if a medic's not available, the only thing we can do is get to the hospital as quickly as possible. So I think the time is right now, based on what I've seen as far as calls, that this is a necessary service.
Just Brian Smith, Broadway, just a question for the chief, if you don't mind, sir. So I think that when he said recouping the cost, that's because typically ambulance services are recouped through insurance company claims. So that would be the same for paramedics. So over time, the cost to the town, we would recover those costs, is what that point was?
Well, part of it. Right now, last year, the fire department, through their ambulance service, brought in about $580,000. That shows on the revenue side.
Right.
The ALS will bring in more. What we're trying to figure out is how much more.
Gotcha.
We recognize that there's an upfront cost. Gear up the current vehicles. Potentially there could be an additional cost for another vehicle that would allow the paramed to go out in a separate vehicle and then come back should not be needed or not make the transport to the hospital. Right now, and then there's an annual cost that right now we're looking at maybe about $350,000 for the first year plus $100,000 startup, so $450 for the first year, and then without cost increases about $450 for the second year. The revenue, we don't have a good number on it because we don't have a good history on it. So we've seen estimates of maybe another 150 to 250. Naturally, the revenue is slower to climb in the beginning because you got to put the people on first, get them trained, certified. So you're paying them during that process. So the additional revenue, isn't there. So what ultimately we'll be balancing is what's the net impact on the, on the budget. Basically the taxpayer, if everything else stayed the same and you increase the budget, in the first year by a net of, let's say, $300,000, you're looking about adding about 30 cents onto the mill rate, with that, which is a...
Rob, can I just add that there's going to be a presentation, probably at a Board of Selectmen meeting, that's going to go through the whole paramedic program and their proposal and everything, so that we can educate. I've been working with the fire department as the liaison from the Board of Selectmen, so that's going to come forward and make it public to the town, all the different pieces of it. So I think it will explain it in a more complete and better way than just...
Yeah, I think it's definitely going to explain in terms of what the chief just talked about. I think what we still have some ways to go. As Board of Finance, we recognize the importance of the program. We also have to be able to know what the cost is to present it to the taxpayer and be comfortable that the numbers are based on sound underlying principles that we can say to the town, definitely this is going to cost you roughly this. Now we can't absolutely at this point because we don't know what the revenue side is. I think we can come close with the expense side. But as a Board of Finance, we're charged with the number side of it. And at some point the decision is, does it go in the budget, doesn't go in the budget. But more importantly than that, if it goes in the budget, we have to feel comfortable as a board that the numbers that we're presented with are numbers that we can justify and stand behind. And that's what, Roberta, who's no longer on our board, and Rosemary and Chief and I have been going back and forth with me trying to gather additional information so that I can, quantify that. I mean, right now I'm looking at 7 or 8 pages of ledgers, and the numbers keep changing, from week to week. And so at some point, when those final numbers, come to us, we need something that's not 7 pages, and we need something that we can look at and say, okay, we understand the numbers and we know where they came from. And that's what we're struggling through right now.
Is there some data that's available out there? Does CCM have any data on other towns' experiences in general terms or anything like that?
Well, the problem, I think the problem, Chief, is that basically right now, what happens is a bill goes to our billing company, and they bill the insurance. Now, basically, some of those are just basic services. We get it all. Some it's bundled. At some point, that stuff gets separated. Getting data from the billing company, to try to determine historically, how many of those calls are a combination, what's the breakout on the calls, and then you have Middlesex that basically bills directly at the same time that we're sending a bundle bill, so they're collecting money over here. So I mean, there's a lot of moving parts, and I think Gene and the Chief are trying to work with the billing company to try to see how much data they have. I mean, one of the problems we had initially with the numbers is that when you take the historicals and you try to do the multiplication out to find out the total, it doesn't jive with what we took in, even on the basic side. So it's difficult because, I don't know if anybody's ever looked at their explanation of benefits when it goes out. I mean, you bill for, the ambulance company bills for say $1,200, and Medicare approves 60% of that, and Medicaid approves 50 cents, and some insurance companies pay at 70, and some pay at 80, and so you're not even getting a consistent reimbursement. And so if the mix of people, if there's more, one year there's more private insurance than Medicare, more Medicare than Medicaid, or vice versa. I mean, it's difficult because what happens is when you look to the future and know what you have to track, you specifically make sure that information is being tracked. And I think that's the difficulty is just trying to determine, what are the numbers, because nothing's ever consistent in terms of when we bill, what we're going to get, what Middlesex or American Ambulance is getting, what they're getting separately. I don't know, Chief, am I articulating that correctly? Or?
Yeah, absolutely. When we look at the town of Colchester, there's a term called payer mix, and a payer mix it looks at the demographics and people's ability to pay. Some people have full insurance, some people are on Medicaid, Medicare. Some people, when they're billed, can only pay a certain amount, and then it's out of pocket. Insurance will only pay. So we are guesstimating, looking at our calls and our potential ALS calls, but putting a dollar figure per call is difficult to do. It's not like we're producing a $50 product and we know it's $50, and down the road you're going to get that. We don't know that. So it's hard to tell unless we actually get up and run for a while to see what we're going to bring in. So that's where we stand, and the chair is exactly right. It's just a complex billing system, and we don't have a full grasp on the revenue side.
Chief, have you looked into like ASM coming in?
We've looked
or American?
American has come in, yes.
American would come in and do ALS calls?
Correct, but what happens then is that we have 2 licenses in the town of Colchester to provide. We provide first responder, and ambulance transport. Those are the 2 things we do. So if American was to come in, they're going to bill. If they transport, that's the key. If they transport, they're able to bill. Right. We're still going to the same call. Our call volume is not going to go down. Our expenses are not going down. So why not have the staffing here? We cover some of the costs. And we're also putting on paramedic firefighters when ASM comes in, because we have a staffing problem here as far as call volume. We did 2,224 calls last year. It's the highest we've ever done. We have approximately 100 volunteers, and we have a career staff of 7. okay? And we try to manage that. So we're taxed in a lot of reasons. So if we do bring in the staffing ourselves, we do have a two skill set, paramedic and a firefighter, to take a look at the whole picture of what the response is in the town of Colchester. So yes, you can take a look at commercial entities coming in, but you got to realize if they bill, we're going to lose BLS billing too at some level, because they're going to be taking that call and billing. In other words, if there wasn't a paramedic available, we're still billing at the BLS level. If American was to come in and take that transport, we lose that whole BLS. So our 500,000, whatever, that's going to drop too if the commercial service comes in.
Right, you just did the BLS calls, right?
Yep.
And ASM, or whoever it is,
Right.
does only ALS calls.
Correct.
You won't be running to,
Well,
you won't be running to ALS calls.
Right.
You'll be just doing BLS calls.
Right.
Right? So I understand you lose a little bit.
Yeah.
Right? You're looking to put more manpower in, right? How many guys?
The initial year, we're talking about, we need 3 paramedic firefighters doing like 48-hour shifts, and that covers everything except for 24 hours in a week. So we would need a pool of 6 to 10 part-time people to cover the 24-hour difference, and with full-time people, they have vacation, they have sick days, and things of that for backup and stuff like that. So, we came up with a figure that we're not quite sure what that formula is going to be until we get up and run. But one of the best ways to manage increased revenue is to manage expenses. So once we get up and running, I think we'll be able to fine tune what we're doing, as we proceed. So when we get to, there's an initial plan of 3 people, and we have 1 paramedic right now that's licensed, that's a member of the fire department, but we cannot do paramedic interventions because we are not licensed.
Right.
So we'd be hiring 2 to begin with, and then when we're up and running and we see what the revenue and expenses are, we'd like to go to full implementation and hire another one. So when all's said and done, yes, 3 paramedic firefighters will be added to our staff of 7 career. So it'll be 10 full-time people plus 100 volunteers.
Okay.
In the system.
And the training for the paramedics?
There'll be paramedics, we're hiring skilled, experienced paramedics. Maybe as we get into, up and running, and we have people that are interested that want to go to paramedics, we make some kind of arrangement. But right now, we're only going to hire skilled, experienced paramedics to start the program.
For a full-time?
Yes.
I got the floor. So no EMS as far as EMS personnel, as far as like a trainer you're going to have to school to keep all their skills up.
Yes.
You're going to have
Well, we
those?
do that now at the EMT level. We have to refresh so many hours a year. Paramedics.
Right.
An EMT is a certification level. A paramedic is actually a licensed Department of Public Health, so it's a higher level of service.
Yeah.
And they have their own criteria and curriculum that they have to meet in order to stay licensed.
I know just a little bit because I'm a paramedic firefighter myself.
Yes.
For 18 years.
Yep.
So I know just a little bit about it. But not here, of course. Just ask some questions, that's all.
Yeah.
But it sounds like you got a good hold of it. Excellent.
We're trying to.
Yeah, you are.
But it is complicated.
It's a big ball.
It is complicated.
It's a huge ball. It really is.
And we are looking at outside
Thank you, Chief.
because we feel we have that obligation to compare. Art and I did meet with the American Ambulance about before Christmas, just to get a feel and, in terms of options, and, some of the options were the possible options were a little different than what the chief, explained, where basically they would put 2 people in our firehouse, we would pay them a certain fee, and basically the revenue would all come in here. As the chief brings up, there's certain disadvantages and pitfalls in doing that, and we recognize that, and we got to learn more about the differences. Trying to assess the cost is difficult because even though initially American Ambulance says, well, if we know how many calls, we can give you an estimate. Well, once they found out we would have to go out to bid if we decided to go that route, they really didn't want to, they weren't as forthcoming with the financial side of it. But certainly we feel we have an obligation to say, okay, there are alternatives out there. What's the cost? What's the advantage? What's the disadvantage? And weigh that. Here, at this point, it's going to be very difficult to get this into this year's budget. I mean, we're so close to this year's budget. We don't have the we're not close to having the numbers yet. It's not saying we can't get them, but based on how long we've been trying to put them together and where we are, there's some work to be done. It can be done, but the budgets are presented to the Board of Finance in the town in less than 2 months. So there's a lot of work to be done. As Rosemary said, we are having a presentation, but there's work to be done. And personally, as a Board of Finance member, the numbers have to work. And we have to know what the numbers are and feel comfortable with the numbers to assess, whether we're going to approve the financial side of it and put it in the budget. And so, we certainly understand the value of it. Maybe only one of us on Board of Finance is of the age that, Art's certainly of the age.
I would use the paramedic.
Yeah, no, Art's used it. Although, and based on my gray hair and my balding head, I'm in that neighborhood. Fortunately, I haven't been in a position of needing it, but I'm of the age that could happen. So I understand the importance of this, and the importance of delays in response time can be a matter of life and death. And so certainly the decision here, in terms of moving forward is critical, but we also have to have the numbers that we can say to the public, these are the numbers, we believe that these are the numbers, come close on the revenue side, and be pretty close on the expense side. So we still have learning to do, and and we will have a presentation hopefully in 2 weeks.
Kevin Alvarez, live in town. Just want to say that I understand that it might be very difficult to put it in the next 2-month period of the budget, and I appreciate the board doing their due diligence on it, because I think that's incredibly important. But on its face, as somebody that lives in town, I think the benefits of something like this, I don't think the fire department asks for that many. This isn't an extravagant request by any means. It sounds like a critical part of the service that they're trying to offer. And I think if we're going to be looking towards the future of our town and trying to make sure that it's a good one that attracts people, we need a government that's responsive to the needs of our agencies and our community members. And if you haven't seen this many people turn out to a board meeting in all the time that you've been here, I just think if it's a service that our fire department is saying we need, I just think it's something that is vitally important to try to get to those numbers. If you're not able to, I understand that, but I just want to stress that it's not just the fire department that thinks it's important. I think as a member of the community, if they're saying they want to provide service better and there's a gap in service right now, then that's something that I hope that we're able to do. And I appreciate the fact that so many people showed up to make that clear, because I was unaware of the problem until tonight. And then it was explained to me very clearly, and I think if we're going to be a strong and successful town, we should be responsive to things when they come up.
Yeah, and I made the statement about the budget because we want the numbers.
Yeah, no.
We need the numbers, we want the numbers, we're hoping we'll get the numbers in time. And then John.
Yep, I'm Chuck Maynard. I've been with the fire department for 18 years as well. We've talked a little bit about the revenues the fire department already generates for the town, about $580,000, give or take, from year to year. That's significant, and that's always gone to the general fund. It's never been solely designated for the running of the fire department. That's a point to keep in mind. We know what the expenses to this program will be. We've defined those for you. What we don't know is what the revenue will be. We approved the budget last year not knowing what income we were going to get from the state. So this is not unprecedented to not know what the income side of the equation is going to be. We can define the expenses. We can present that to the town for a budget. And the revenue, we can estimate. It may be higher, may be lower, but it's going to be significantly less than the difference we would have seen with the state not knowing those numbers.
Thank you. John and then Mary.
I just had a couple of diverse topics. One is I fully support this kind of program, but not just because it could serve the elderly, even though I'm beginning to get there. But also because a lot of young people may be in need of the service. And you can't lose sight of that. I mean, we just had Kevin with Andreas up here in Millville, and who knows? The other factor that was mentioned tonight here is the substitute pay. Just for the record, I'm a retired teacher, and I've been retired for more than 20 years. And I have no desire to be a substitute teacher, particularly at this point in my life. But I really do think that they should receive an increase, particularly with the possibility of the minimum wage going up. And I was going to talk on something else and forgot what it
Just before we go to Mary, one thing that many people don't understand is Board of Finance, when it comes to the Board of Ed, approves the bottom line. We try to understand every line that gets to the bottom line, to understand what goes into it. And certainly there's things in there, especially when it comes to the insurance funding, that is so critical to us. If that number doesn't work, we're concerned with the bottom line. But as George brought up the substitute teacher, pay, Board of Finance does not make a decision on that, but there are Board of Ed members here that will take that information back to the Board of Ed.
I was counting on that.
We'll take it back there. So I just wanted, in terms of Board of Finance, we can't control something like the substitute pay because that's not in our decision. But that message will get back to Board of Ed. Mary?
Thank you.
Mary Byron, I think one thing that got left out, I had attended a couple of the paramedic presentations. One is that the cost of the current coverage for ALS is increasing, right? We were told, that was one of the parts that was pointed out in the presentation, that it's going to cost us more money to do exactly what we're doing right now anyway. And the second thing is around the numbers that you need to help make an intelligent decision about whether to move forward or not and what the impact would be on the taxpayer. I'm hoping that somebody knows exactly what it is specifically you want and that there is going to be the ability to give you better information 2, 3, 4, 5 months from now than right now. Because it sounds to me like some of the issue around getting the accurate information isn't going to improve because we wait another 3 or 4 months. It has to do with the way the billing is done, the way the statistics are kept. Some of the things are totally out of our hands. The way insurance reimburses, I mean, what the heck, that could completely change. But that quick, we have no control over it. So if we're going to delay, which is what I really heard from you, and I'm disappointed about that, I hope that you have a plan for how we're going to get the information we need so that we can make a decision. I agree with John and Kevin. The number of people here, I mean, I took pictures last year. This room was empty. And to have all these people come out here and feel so strongly about something, I mean, our job, I'm on the Board of Education, and I did write down your amount of pay per hour. We're supposed to carry out what the people tell us as elected officials. And I know what I'm hearing loud and clear today. Thank you.
Chief will, I think Chief will admit that over the last several months, and me in particular over the last week or so, we've been going back and forth with me asking questions, some numbers questions, some just trying to understand some of the underlying principles. So I've been extremely diligent. I poured over 6 pages of ledgers that were in PDF file with columns cut off that I couldn't identify the cells, trying to do the math to see where the cells referred to. So I probably in the last week and a half have probably spent 6, 7 hours, not counting the time writing to the chief. Just so, I mean, I am working hard to get these numbers, and I've been working hard for 9 months to get these numbers.
But that's my point. What's going to be different?
Well, the program, first of all, the program changes. The program, the assumptions seem to change as this evolves. The numbers are changing. We went from, and I understand why. I mean, we had a $75,000 response car used. Now we have a $12,000 response car used and a 45 mil. Now I know why there's a difference now, but trying to get to why did we have a 75? Why were we hiring this many people in this plan, and a week ago we were reallocating people? Why were we doing this in year 1? Now we're doing it in year 3.
The plan has not been static since the presentation 9 months ago. The numbers are different, and basically we have a responsibility when we put something into the budget to be able to justify the numbers to the public. That's our job. And the numbers, it's not that the numbers have to work. I mean, we have to feel confident that they are the numbers. When I say the numbers work, people say, well, does that mean if it costs too much, you don't want to do it? Well, it's certainly going to be, if 38% of the people said no tax increase, and this is going to increase the taxes by 30 cents, do we, even if everything else stayed the same, do we throw that out there and say it's the paramed program that's the excess, and then have people vote on the budget based on that? Well, it's not that simple because there's so many moving parts. So it's difficult. We understand the importance. We understand, in terms of the, right from the start, the chief saying, well, there's a time clock in terms of getting the certification. And basically, they've done a lot of work to get to the point where they're close to moving through the next steps to get the certification, and a delay of a year could cause big problem. Not only loss of license, but even getting the program off the ground. We're cognizant of that. And part of my statement is a plea to get the numbers. Having a presentation in 2 weeks is a great thing. I've seen a draft of the presentation, but to me, understanding the numbers, there's not a lot of questions we can ask at that. I mean, we have to get the information before, because, when you make a decision quickly, things tend to fall apart and mistakes are made. Audrey, and then in the back of the room, and then third person over there.
So I just want to touch on that, the delay in starting this up. As you may or may not know, we hold the certifications for the public service area, which is the PSA, for our first responder and our BLS ambulance, which means that the ALS PSA for the town of Colchester is currently open. That being said, the delay in us moving this program along could mean that another service that already has an ALS program available could submit that application to the state of Connecticut Department of Public Health and take over that service here in the town. That being said, we're going to lose that money. So not only are we not going to recuperate that BLS portion of that transport, any of those transports that are now ALS, we're not going to recuperate any of that money.
Okay. That brings up a question I don't want to ask here, so I'm hoping that question comes up again in 2 weeks. Because there's more information I want on that, but this is an open forum, so I don't want to focus, but I appreciate you bringing that up. Deanna, and then the back corner.
Yeah, I just have two points. And one which you said, just like you pointed out, that the citizens, you obviously see a need, there's people here, and it's something that we want, it's something that we need. So I think that goes back to Mr. Schuster. When you talk about, well, it might cost 30 cents extra, move the mill rate up. But that's when you need to balance. So maybe if this is what's really important and this is what the citizens want, you're going to have to look at that budget and look at something that might not be such a pressing need but more of a want, and balance that out. Because I agree with everyone here that this is something that's needed. I was here last year when you started talking about it, or the year before, and I think that the support here in the room, just like Mary said, shows that this is a real big pressing need. Not only are they talking about the older folks in town, but we have a drug problem in this town. Yes. And these guys are working really hard going out there, and they're saving a lot of young kids' lives in this town. There's a lot of people in this room that might not know that, but I know people in here that have responded to those calls are very much affected by what they're seeing in town. And the other thing that I want to bring up is this gentleman stood up and said their fund balance, in other words, what they make, goes back to the general fund. That really struck me. Now, we take other monies in town that get put away or put aside for special things. Why are we taking the money that's being generated by the fire department and the services they provide and putting it back in the slush fund? Why don't we set something up where that money is there for them? And if we had done that before, maybe we'd be in a better position now to have that money available.
Amen.
Let me explain slush fund.
ambulance.
revenue from the
For lack of a better word.
the revenue from the ambulance reduces down the mill rate and the taxes that we pay. Okay, I'm not sure how much of the $1.6 million, $1.6 million fire department, it's been a long time since I've looked at the budget, $1.5 million.
1.3 right now.
So there's a $1.3 million budget, I don't know what portion of that is EMT, we've tried to kind of quantify it. It's hard because people are wearing two hats. And certainly the fact is that one of the values that the chief brought up in terms of doing it in-house is that you're hiring a person that's wearing two hats. You're getting a paramed and you're getting a firefighter. Bringing in somebody from American Ambulance, that's a paramedic. If there's a fire, they're still, unless there's life at risk, they're not running out to fight a brush fire, where they would maybe if they were a firefighter. So the revenue that comes in, when we estimate the revenue, whether it be for building permits, whether it be for tuition from Norwich, which goes into the general fund, that money, when we assume that money, yeah, it goes into the general fund, but not for long. Because basically all of our taxes are reduced down by that revenue that comes in. And that's not to diminish the fact that the amount of money they bring in is a big help to us in keeping our taxes down. But it's certainly not a slush fund. And it doesn't just go into a pot and sit there for some other use. It immediately reduces down the mill rate that we're going to pay in our taxes, as does almost every other revenue. I think one of the few ones that doesn't is the recreational program fund. But basically that money, even though it goes into program fund, okay, that money that would have been to provide those recreational activities in our budget isn't. There's very little in the budget right now on the recreation side. Most of it is being paid by the program fund, including the 57 Fest that up to this point hasn't cost the town a dime. People question, why are we spending money on the 57 Fest? Up to this point, we haven't spent any money on the 57 Fest. It's all been fundraising and money from the program fund. Back corner?
Jared Shua, I'm a resident of Colchester, been in an apartment for 13 years. I'm in favor of this program. The one thing that you said, and that really put it in the back of my head as far as you said that, it may not make this budget year. I think that saying that is kind of a little bit more of a, I think it's a kind of a poor attitude, or I think that I understand that you guys are working towards it, but I was wondering if the board would be interested in doing maybe special meetings to specifically discuss this paramedic program, or to maybe dedicate a little bit more time with the board as a whole and also the department, and also with the public, present that presentation that maybe could have been done tonight. Maybe do it next week rather than 2 weeks, and keep pushing it off to the point where it's not ready for that budget, so you guys have a full understanding of the numbers and the program as a whole. So that was my question, is would you guys be interested in doing special meetings to discuss this paramedic program?
Yeah, I think there's two levels of special meeting. One is public information, and one is ours. We had our first presentation, I think, back in last April or May, back in the spring, during the last budget season. I kind of had it on follow-up presentations on the agenda almost every meeting. It just wasn't ready. I think we had a second presentation in September or October at that point. We also hope to get it on the agenda again before Christmas. First meeting in January. And Roberta and Rosemary had met a number of times, also with them, trying to get it. I mean, there's a presentation scheduled for we're planning on having a presentation in 2 weeks.
Is there a specific date for that presentation?
I don't know, are we doing it as a joint meeting, or yeah? Well, I won't be there because I'll be away. I'll be there the night before. For a joint meeting, I won't be there for the board select. Just so you know ahead of time. We originally was scheduled for a joint meeting tonight. In between this meeting and our regular meeting. So it was scheduled for tonight. The numbers just weren't, the stuff just, it wasn't totally ready in time.
So I think that like, I'll just try and, have a more positive approach to it and push towards getting this into the budget, because not only is it, you understand the expenses portion of it, you may not understand the revenue portion of it, but as far as the service portion of it and getting that level of care to the town of Colchester, you understand that fully too. I think that getting into this budget, saving, that extra year of the startup, but at the same time providing that level of care to the town of Colchester is very vital, and I think that we should be having a more positive approach and pushing towards that, getting to that goal of getting into this budget year.
Let me ask a question, because I heard two people talk about wants and versus needs, and sometimes one person's wants is another person's needs and vice versa. When we talk about wants, what do people see in the current budget that you look at and say, that's a want, we shouldn't have it in?
So I don't really have an answer to that question. I mean, in any sort of situation where you ask people what they want in government, they want all the services and they don't want to pay for anything. Like that's the reality that you're faced with. And for the last several years, we've been able to pass budgets because there haven't been tax increases. But prior to that, like when I was going through the school system here, we built a new school. We were the fastest growing town in the state. We were the 57th best place to live in the country. And frankly, it's because to some extent we were actually investing in the things that we needed. And then time and again, people in the town showed up and started voting down the budget constantly. And that's the problem that you are charged with every single time. When we're talking about wants versus needs, I think a lot of people categorize any sort of tax increase, regardless of what it's spending on, is a want, and that any education spending is frivolous, and it's not. And I think as a resident of this town, I am willing to spend money to get better schools. Where we have an opportunity in the state where the state is actually, the economy is doing a little bit better than it was before. We have a new or a renovated school in William J. We can actually be a town that attracts people, but we got to make sure that we are investing in the long-term needs of our town. It's not pitting our fire department against our school teachers. It's not this or that. I think we need to both invest in education and invest in our fire department. One of the things brought up before, I'm a young person, I've used paramedic services before. Down the street from me, one of my friends growing up died from an opioid overdose. And if we don't invest in our education, we're going to have more people dying from that because they're not educated on the dangers of it. So we need to understand that these are comprehensive problems, and we cannot just slash our budgets year after year if we expect any sort of progress in our town, and we can't blame you for every single time trying desperately to do this hard, grueling work, and then expect that you're never going to raise taxes because we want everything and you don't want to spend any money for it. So, I don't know if that answers that question at all, but I'm sorry for the position that we're all in because of that.
Can we speak independently as members? Sure. Okay, first, I want to just say that I'm happy that everyone is here and that we have such a great turnout. Number two, I'm open to all your suggestions. I'm not saying no to anything. I think there's something that we also have to consider is what is coming from the state. There are a lot of mysteries coming from the state. Increase in taxes seems like grocery tax, we're gonna have the tolls, the medicine. It seems like we're getting hit with something every day, a proposal every day. So we gotta keep that in mind as we develop this budget. But I'm glad that the fire department came out in droves to say, hey, support us. We got this, we're confident. And as an independent from the board, I'm willing to see any data or information that you have. If you feel that you're comfortable and you feel that you're not getting a fair shake in any way, I'm willing to take a look at that and, begin a conversation or a dialogue that'll make you guys comfortable. If we can move something forward, I'd rather keep it in-house if the numbers work than go somewhere else and almost send a message that we don't have confidence in our own community. That's just my 2 cents.
Yeah, thank you. And what Andreas was talking about in terms of the state, next week, next Thursday, I think our state reps are going to be here at 6. Tomorrow. 6:30? 6 o'clock. I think it's important that as many of you can come to that, because basically I get the feeling, that it's more than a feeling, that when a person becomes a state rep or a state senator, for some reason they believe that cutting a
to Colchester and other towns is not a tax. And 2 years ago, they threatened to cut 6 million, was it, with between the paying for the teacher pension and the money. They rolled it back. We ended up with about $1.5 million cut, $3,700,000 cut from the state. You know, last year we had a cut, but it was a lot less than what they had told us it was going to be, and so we ended up in a pretty good shape because we got cut less than we thought we were going to get cut. We now have a new governor. We have a new makeup of the Senate, a new makeup of the House, and the state has a 2-year budget. So they pass a 2-year budget and then tweak it in the second year. So this is the first year of the budget. We delayed the start of our budget season for a whole month because last time we didn't actually get the numbers. 2 years ago we got them like in September, October. You know, we got to get our budget approved before July 1st. We've always done a budget process so that we can get definitely 2 referendums in if needed, and usually a third. This year we will only get 1 in because we want to make sure we have some direction from the state. That doesn't mean we're going to have the number, but I think we have to tell our state reps that cutting aid to us is just switching. We're, instead of increasing the tax at the state level and us paying it to you and you having the courage to say we increase taxes to cover the things, you pretend that you didn't increase the taxes and you cut the aid to us and increase our property taxes here. And so, you know, that's the type of thing that, you know, I know a lot of people in the budget said, survey when we talked about cuts from the state said they didn't realize there was cuts from the state. And we were kind of happy to get 1.7 when we thought it was going to be between 3 and 6. But 1.7 was tough, and it was that number came to us way after we had gone to referendum. And
the referendum was passed. The budgets were passed when we got them.
And we had no revenue numbers from the state yet. If anybody else on the board want to make any comments on that?
No, and again, just like you're saying, again, that $1.7 million in cuts was from the economic cost sharing, and that economic cost sharing grants that we get from the state was frozen at 13 some odd million dollars for about almost 10 years, correct? Something along those lines? Again, so essentially what they did was simply froze, instead of redoing the formulas, they froze all the economic cost sharing grants to the various communities, and again, never increasing those for inflation or for costs or anything else like that. So we were getting 13 point, again, the percentage of money from the state to cover our educational costs was much greater, obviously 10, 12 years ago. So there's a much greater percentage of our educational costs than it is now. So we're getting less and less as far as from the state as we move forward. So.
We were the 3rd highest town cut, and people asked why. Well, other than there's 40 districts they identify as alliance districts, and these are what they consider underperforming, and therefore they don't cut them. Of everybody else, we get the 3rd highest ECS money.
Decrease in population, school population.
And that was even before the 4th. We were basically the 3rd. Okay, so when they cut everybody 11%, well, who got impacted the most? 11% of the 3rd highest number is the 3rd highest cut. Now, 2 years ago, they basically created a new formula. The reason that we were frozen was because they basically, although it wasn't, they held all the towns harmless that you would never get less this year than you got last year. And since part of the formula is declining enrollment, and most towns have declining enrollment, we've just had more than others. And so one of the things that Board of Finance every year says to Board of Ed, we got to understand why, in the face of declining enrollment, do things go up. I've done some research. I know some of the reasons, but I think as board members, as taxpayers, we need to have a better handle on. Because a lot of the comments on the survey were, enrollment's going down. Why is everything going up? Well, there are some real valid reasons why everything's going up. We need to understand those things better. And that's, when the formula was changed last year, that's why we took another hit over and above the 11%. If they don't change the formula,
we will probably go down, but not in terms of the numbers that they've been talking about in the last 2 years, where they were, basically just arbitrarily throwing a number out that we're going to cut everybody across the board 11. Deanna?
Yeah, I just have one last comment, since you brought up the survey. Over and over and over again, if you go back the years since the survey's been started, we have seen that the biggest want, or the biggest thing that the citizens are willing to support is increase in fire and safety. If not number one, number two, over and over and over. And I think Kevin made the comment that it's incumbent upon elected officials to respond to what their citizens are telling them. So if you're going to use that as a guide, then there you go. There you have the answer, not just people in the room. Dismal amount of people that answered the survey, but still, they're all in the same kind of mindset that that's what we need to invest in. But what did shock me is that the number of people that don't know that this program is being offered to the town. So that's a big concern. I can't pull up the number in front of me, but it was that there was a lot of people that had never even heard about it. So we're failing to let our citizens know that we're considering this program. So you might even see more people that are willing to come out and support it if we do a better job at advertising that this is something the town is considering.
Yeah, no, absolutely. And that's why we asked the question. I mean, not only did we ask who was aware of it, but what was the best way to learn of it. And I know Chief had, in his draft presentation, has a pretty detailed public awareness plan, and maybe in view of the response of how people want to hear, trying to make sure that jives. I think our difficulty here is that we're balancing the needs and wants, and some people feel, I mean, when you read the survey, the same person that says I will not pay a penny more in taxes wants trash pickup now included in their taxes. I mean, it's just the reality. Sometimes it's not the same. I mean, we want a community pool, we want the library. Well, we cut back the hours of the library to keep it, keep it open. And we do, not that there isn't always some place to find something. But, we operate pretty leanly. Moody's last year reaffirmed our rating that they had given us a few years ago. And they listed one of the town's weaknesses as that the budget's lean. They said that's a weakness because they don't feel that there's a lot to cut. Standard & Poor's increased our, did the Standard & Poor's get on the website? I know the Moody's is on the website. It's on, yeah, if you read on the website, the Standard & Poor's rating, recent rating, that's more recent than Moody's. Moody's was a reaffirmation. They reassessed all the towns. Most towns got their ratings reduced by Moody's on their existing bonds. Ours were sustained. Standard & Poor's, we got raised two spots with Standard & Poor's. We're AA plus. The federal government's AA plus. There's only a handful of towns in the state that are AAA. So we got the second rate, and the same thing they listed was the lean budget. So again, if people can say, hey, this is something we don't feel should be in the budget. Both on the town and the Board of Ed side. I think it's easier to see wants and needs on the town side because it's a simpler budget, it's smaller. A lot of people were critical of the question on the survey in terms of if the state cuts us again, where should we cut Board of Ed? Should we cut a combination? They asked, why wasn't just the town listed? Cut everything from the town. Well, if we got hit with the amount that they originally said last time from the state, and we took it all from the town, we would have to cut the budget in half. So we don't put a response on there that we believe we couldn't do. I mean, if everybody said cut the town only, it just wasn't possible. We had a kind of a sharing on there. But we're always looking for suggestions when people comb the budget. Is this something you looked at? Is this? I mean, if when the Open Gov, it should be out. I mean, I know the town is almost ready to launch. I don't know if the Board of Ed has signed off on that side of it yet. But the town is going to be released. It was just released to the Board of Finance to just do a double check on it. But if you look at the budgets over the last, I think we have 4 or 5 years of history in there right now. You can see, which departments were cut, which things would stay the same. But we're always looking for ideas and suggestions that, when people say, well, why are we doing that? Sometimes we can explain it, and sometimes we say that's something we need to we need to look at. No matter how much you look at a budget, there's always something, a little something you can find, but there's not a lot of something, anymore, especially on the town side. We understand the town side more because on the town side, we are responsible and we do have the authority to cut line items, not on the Board of Ed side. Other questions or comments? Brian?
Yeah, I'm sorry. I would say one last thing on my part. Anyway, so you asked, is there anything in the budget that we...
And Brian's a former Board of Finance member.
Yes. During those lean years, they were not good years. So one of the things you asked is there something in the budget that we don't need? On the needs wants thing. And I don't have anything to say specifically that I think we don't need. I've always thought that the budgets were very lean here. And I grew up in a town with much bigger budgets, and I've always felt people don't know how good they've got it because they've got, maybe 3/4 or 80% of those services and 60% of the cost that some of these other towns have. So I think that the town's always done a really good job in that regard. But there is something I think we want, and it really doesn't cost anything. Or something that I think we need, not a want. It's a want for me, but I think it's a need for the town. 24, 25 years ago, we spent a lot of time trying to come up with a vision for the town. And at the time, it was a vision of what we need to do to make the town a more desirable place. And it was reinforce all the reasons why we live here now. It was all about really trying to emphasize and enhance our historical and our cultural heritage of our town to make it a place that's more desirable for people who want to come and do business and live. And over the years, partly, I think, and for a number of years, we made some progress in those areas. There was some grant money available in those days, and there were some good things that happened. And then the lean years hit. And in the lean years, we sort of gotten away from that. So if I was to name what I think is a need for the town, it's that we should really take another good hard look at what our vision for our town is. And piggybacking off of the comment that was made earlier about being aspirational, reset some of those aspirational goals so that when we go through these processes, we're attuned to what it is we want to be down the road, and we look for opportunities, both large and small, to get us a little bit closer to that goal.
Thank you.
Just to touch on what Deanna said, and again, some of the other advocates for the paramedic program. This is great. I think as far as the board is concerned, getting this kind of feedback, that's one of our things. It's like, trying to gauge where the feedback, where the town is, the citizens are feeling on some of these programs, especially something new that is a challenge. But again, but getting the word out is twofold, like anything. Getting the word to us, to the boards, and to get it potentially onto the budget, but also getting it out to the citizens so that the citizens can come out and actually support the budget should we be able to get it into the budget. Making sure the fact that you get the word out to everybody as far as this is a new program and some of the benefits. So I'll also do that. That's another part. And again, I think with the crowd here today, that's something that I think you guys can also work on as far as getting it out to the people to support this, because I think it's something, like we've always said, you do want to have something that people can support, as far as the budget. A reason to be voting for, maybe it's a situation where a school budget or a new program or something like that, or something like this. So those are some of the reasons where you can, kind of use to endorse something, moving forward. So.
Any other comments or questions before we close? One here and then over here.
Sir, Evan Evans, was over at Joseph Lane. You said on a number of occasions that you're waiting on numbers. So I used to work for the federal government, and part of my job was budgeting for the section that I worked for, millions of dollars, and it was part of my job is to project what our costs were going to be, what our revenues from the federal government was going to be for the state, or for the National Guard. So there's a methodology to doing it. Who are we waiting on for the numbers? Are we waiting on ourselves? Are we waiting on, and at one point in my life I was a math guy, and I know that you can make projections based on doing a little calculus with what you know in the past. So who are we waiting on for numbers?
Well, first of all, yeah, let me say the fire department, okay? And not that I haven't been given numbers, but the problem is that if what we were showing 2 weeks ago is there's been changes in the program now, and I mean, I got spreadsheets and I got a presentation that I received on the same day. Okay? They're not the same because this was tweaked or that was tweaked. So as the program's still evolving, I mean, I haven't, people say, well, you're waiting for the revenue. I haven't even talked about the revenue side yet. I mean, I'm talking basically, I'm trying to get a firm handle on not only the first year costs, but the increases to those costs. Because I know when you hire as step one, you have a first year cost. In the second year, that person just isn't getting the 2.25% raise. They're moving to the next step down, which when you put the two together is almost a 10% raise, and then another 10%, and then another 10%. Well, when we look at this program, we're not just looking at the first year cost. We're looking at the cost in the second, the third, and the fourth year. It's the same thing, there was a lot of comments on 24/7. Okay, we've been doing the same thing on 24/7, and we've probably been looking at that for 6 or 7 years, trying to get projections and trying to, I think there's more real life situations that you can identify with the paramed program of lives that maybe could have been saved, or maybe not here in town, but in other programs because you couldn't get there fast enough. So right now, I'm just trying to get numbers that when we look at the expense side, okay, I'm looking at the same program this week that I was last week, and that's going to be the program that's going to be, that we're going to start with.
So it's just 2 things. What I said is I am fully in support of the paramedic program, even if we got 0 revenue. I would be fully in support of the paramedic program because in my lifetime I've watched people bleed out and die not in this arena because ALS was not available in time. ALS in the military arrived in enough time to transport the body back to you. I know how important it is. So I don't know who I'm asking, maybe it's you, Chief. What is it the folks in this room can do to help you get those numbers together so that we can get it on the referendum this year? What can we do for you? How can we help?
All right, I'll be the first to testify. Mr. Karloff does his homework. And we go back and forth in emails. But sometimes that's not the best form. Sometimes it's discussion. And when we send out a slide presentation is facts and figures up there, but there's also verbal discussion that goes along to back up facts. And I think with this presentation on the 21st, I think that's an opportunity for the public to see what we have. It has been, you're absolutely right, a dynamic flow of events. When we first, we've been talking about the paramedic program for 7 years. And we're at the point now where I think it's the opportunity to say yes or no. The numbers have changed because it's a difficult thing to get a grasp on. And I by no means am a financial expert, and these people are. What I do know is the fire department, and I think there's just a disconnect in what they're trying to seek and what we're trying to convey, and it's probably we're not meeting, and we need to do that. So I think the process of vetting these numbers has changed over time, and I think the numbers we have an opportunity to meet, and you sit down and I explain it, you may or may not agree or disagree, but I think we're at a point now where I'm confident in the numbers that we have to move forward. So I think
we'll do that before the 21st.
Yes, absolutely.
I know Roberta's met a number of times, but she's not here anymore, and it's hard to get that history when the person isn't here anymore. So we'll set up a time.
Okay.
That we can get together. Rosemary?
Just before we make any final decisions whether it will be in or out of the budget, the Board of Selectmen has not even reacted. I mean, we talked initially about this program going forward, but it's going to come to the Board of Selectmen again, and we'll probably make some kind of recommendation, and then it comes to you as well. But so before we decide that it's absolutely not going to be in this year's budget, we ought to look at the facts that come before us. We ought to look at the presentation. We ought to listen to they've been working with like a consultant who volunteered this time. So, and I've had the opportunity to hear this, and it has changed. But I think it's changed because more information has come forward. And I think you need to be open-minded and let the boards together make a decision before we say that it's absolutely not going to be.
I'm not sure anybody tonight said it was absolutely out of it.
Well, you kind of said that
I said,
earlier.
when you say it's gonna be difficult, but it's still doable, you gotta get us the numbers. That's not saying it's absolutely out. The clock is,
You
the
came
clock is
across that
ticking.
way.
Huh?
You came across that way.
That is absolutely out. I apologize for saying that. My plea was in terms of, is to get, if we get the information, okay? Now, Board of Selectmen may or may not approve it next Tuesday or Thursday at the presentation. Then it's gonna come to board, or, yeah, 2 weeks from now. Then it's not gonna come to Board of Finance until March. And we never decide on the first night that we get
We need to work that out so that we all get to see it the same night and can hear the questions that everybody has and we can hear the answers. Because I think when we hear it in different forms, it doesn't always.
Well, I already told you, if it's on the 21st, I'm not there.
I think you and Art can work that out.
Well, there are other board members that would be willing to help out with the fire department. It's just not a one-man board. So we'd all like to be, if we can help in any way or possible, I'm willing to extend a hand. We have a lot of people coming out, so let's streamline the process. I think Rosemary's correct. We get everybody in the same room, we ask those questions, and we figure out what we're gonna do. So, you know.
We've never created a delay in this process. We've never created a delay. We've had many presentations. I don't know that you've been to all the presentations. I don't make every one of your meetings. I don't know that you make every one of ours. I'm not saying pick a day either.
And I will tell, and again, I will say what I said before, I had this on our agenda almost every single meeting since last May, and when I was about to send it out on Friday, not ready yet. Not ready. And I understand, it's complicated, but I'm just saying the effort from Board of Finance over the last 6 months to get more information and presentation on our agenda, okay, every other week, we've said, are you ready yet? Okay, and they're not, and I understand why. I mean, it's complicated, but it wasn't from lack of effort on our part to get on the agenda. Now we're a month, but we're 2 months from the presentations, so that means Art has to have it in his budget a month before that. I mean, I'm just being honest, it's going to be tough. I'm not saying it's absolutely out. I wouldn't make that statement. I apologize if I came across that it's absolutely out. I just said it's going to be hard. If we get the information, there's still time, and I know I said that, but we have to have the information. And up to this point, for 9 months we've been trying to get the information. I mean, Roberta's met with the chief, I think, several times that you weren't there, trying to get the numbers. And after the last meeting, she still said, "I'm not comfortable with the numbers."
I think a good start would be to see Roberta's numbers, because as the rest of the board...
Roberta's numbers are their numbers. She doesn't accept their number yet.
Okay.
Okay. Yeah, but I think she was focusing more. Roberta was focusing more on the revenue side and the assumptions that were being made there. The questions I have with the chief are more, well, I don't understand. This wasn't here last week. Why is it here now? Why are we reallocating 2 people to 3 positions? How can you reallocate to 3 when you only have 2?
Rob, it's a situation with that they're refining the program, looking at some of the needs and making sure the fact that, as they're moving it forward, it's getting more and more refined and they're fine tuning it.
Well, but at some point,
obviously, at some point you have to finalize the proposal, submit the proposal so that we can actually move on.
Good. So what I'll do is I'll send out dates to you, Chief. I'll send the same dates out to you. The tough part always is it seems like it's daytimes generally that are available. I don't know if you're available in the evening, Chief.
I'll make myself available.
Okay, because I mean I'm free evenings, and I can make my days a lot of days available. But I know your days are not good for you.
Anytime after school.
Yeah, but that's what I mean. and after school sometimes is a different.
Yeah, sure, but yeah, let's get a.
So
look at a calendar.
we'll reach out. We'll reach out before the 21st. I'll reach out tomorrow with dates so we can have a meeting, next week or the early part of the following week before the meeting, on the 21st, and see if we can get the numbers ready, for that meeting.
Quick question.
Last question, because you've had your hand raised for a while.
And it is completely unrelated to this. So I do really appreciate the due diligence that you are doing and all of the work that you put in for free, because this is a volunteer position. So all of that, thank you. My question that's unrelated is, has the town applied for or received any community development block grant funding in the last several years? Like, do we?
Yeah, Maggie, you would be the best one to answer that.
Yeah, we actually get small cities, not full-blown community development because we're under 50,000. But yes, we just did an $800,000 small cities grant that was involved with doing some improvements at one of the housing authority projects.
Yeah. And I think Halls Hill Road is being paid with some sort of grant.
It's a grant, but it's not small cities.
But it's a grant. I mean, I'm just saying,
Yes, we did lots
we
of
seek
grant
grant money, constantly.
Yeah.
And I think Board of Ed also is always looking for grant money. So if it's out there, we try to get it. Sometimes we're successful.
Yeah, I was just curious because
We got about $1.3 million last year in grants. The biggest one is Halls Hill reconstruction. That's going to start in the spring. We got a grant to replace the bridge at Norton Mill. That was $150,000. So if there's a grant, like Bob said, there's something out there, we go after it, and we get our share.
I know the Department of Housing has run that sometimes as and I'm not clear on all of the details, but as a loan program, so they'll give the town a grant and then the town has to loan that money out. Have we ever used it in that fashion?
Yes, we have. We've done it for housing rehab loans, and once you're in that kind of a program, it's always the money as it gets paid back has to be put back in. So we originally got into the housing rehab loan long before I got here, but there's still a small amount of money, and we do get applicants. Some people qualify, some people do not. A portion of that money was reallocated through the state to the small cities grant that I just referred to for the housing authority to bring that grant to a conclusion. So.
And I also know the chief is looking for grants for the paramed program. I think they represent safer
Federal
grants
grants out there to help support that.
Yeah, so even on the paramed program, the chief is looking into possible sources of grants. I know the safer grant is kind of a, to help you get started, and we used it for the fire department about 10 years ago. That basically gives you money to expand and get started up, and then slowly kind of decreases, and you got to promise you won't make any, you won't change what the people that finance, you won't change those for a certain amount of time.
And it's federal grant money to supplement, not supplant role.
Yeah.
Key.
Yeah, so even here, I know the chief is looking for some grants.
It's also how some areas, some years the police force was run as well, was the federal grant.
Federal grants, yeah. Okay, well, appreciate the feedback and coming. One last one, because I knew you had your hand up earlier.
Yes, sir. Thank you. Good evening, ladies and gentlemen. My name is Ryan Flaherty. I've grown up in the fire service of Eastern Connecticut and have 11 years experience as a volunteer and career firefighter. Since November 2nd, 2010, I've also dispatched the Colchester Emergency Services. The Colchester Fire Department protects over 16,000 people spanned across 49 square miles with a staff of dedicated volunteer and career firefighters out of 2 stations. The department responded to 2,224 calls last year for a wide variety of emergencies such as fires, crashes, hazardous materials incidents, and medicals. The department's call volume and training requirements have been increasing every year, which puts a serious burden on all of the members. Oftentimes as dispatchers, we find ourselves having to dispatch the department 2 or 3 times trying to get enough help to respond, which only delays the life-saving services this department renders. The lady in the 3rd row said residents will be paying more without any difference or benefits, which is completely false. When it comes to paramedics, Colchester residents have to wait for a paramedic to hopefully come from Marlborough, or a second medic from the city of Middletown or Norwich, which may or may not be available since these are extremely busy services. I'd also like to point out that a fair share of these patients are not able to receive a paramedic due to missed intercepts, which wouldn't happen if Colchester had their own paramedics. Would any of you be all right knowing your family member may have to wait over 20 minutes for them to receive advanced life support, including airway management and medications? I dispatched a fatal 2-car head-on crash with fire and 3 people trapped in front of Desmond's on Tuesday, January 22nd, last month, and it took one of the paramedics 29 minutes to arrive. Colchester was also dispatched mutual aid to East Hampton for a building fire last Thursday and had to be retoned for manpower due to a lack of staffing. This incident is clearly another example of why this department needs more staffing. The startup cost for firefighter paramedics may seem high, but the revenue brought in from transporting will refund a large portion of that. Having the 24/7 staffing will also assure the residents that calls will not be dropped or missed, which will prevent other towns such as Hebron, Salem, Basra, Marlborough, East Haddam from having to provide mutual aid for our smaller incidents. I have heard some people say they are only struggling for ambulance crews, which couldn't be any further from the truth. I applaud Chief Cox for pushing the town to hire cross-trained firefighter paramedics, which will give the residents the most cost-efficient way of delivering these vital services. Some people recommended giving the ALS services to a commercial ambulance provider, which is insane, since those providers cannot drive a fire truck or provide any type of firefighting services, which is also a critical role that we cannot forget about. Also, please don't forget that those commercial companies are for profit and will not give anything back to this great town. The fact that Colchester's transporting revenue goes back to the general fund is also flawed. Those funds should be deferred back to the fire department to offset the cost of manpower, fire apparatus, and equipment. I'd also like to clarify that this proposal is not eliminating any of these great volunteers. This will finally provide 24/7 coverage, which is long overdue. Better staffing and a higher level of care is clearly a win for everyone and should pass unanimously. The fact that the proposal has already been delayed 2 weeks to February 21st supposedly, and that you said you're not sure if this will be able to be in this year's budget truly disappoints me. The safety of your citizens should be your first priority. Clearly this isn't a want. Please do your job and consider this a need.
We appreciate everybody coming out and the feedback. Remember tomorrow night, 6 o'clock, if you can return to Town Hall and let the legislators know. And check the website to see when the presentation will be by Chief Cox on the paramedic program. Thank you. Recess for 5 minutes before we start the Board of Finance.